It's time to finish up the integumentary system. Cover a few last topics here. Let's talk about burns. Burns can be caused by heat, by electricity, by chemicals, and by radiation. A lot of different ways to burn the skin. What happens with burns is you denature cell proteins and cause cell death. And that's very bad because when cells die, now you've got the potential for bacteria, infection to move in. Plus, whatever those cells were doing before, they're not doing now, so you're losing function of some sort. Now, the rule of nines is a quick method to approximate the extent of burn damage. So look at that illustration in the upper left. So your face is roughly 4.5% of the skin on your body. The back of your head would be another 4.5%. The front of your arm is around 4.5%. The back of your arm is another 4.5%. The anterior of your trunk is around 18%. The front of each leg is 9%. The back of each leg is 9%. So you can see why they call it the rule of nines. What's twice times 4.5? Yeah, that's 9. So what's going on here is that the rule of nines is used in triage, for example. I ask usually if we're in the classroom, if someone knows what triage is, and someone waves their hand, and I let them tell everybody what triage is, and I say, no, that was completely wrong. But then they actually usually do tell the right answer. So triage, basically, let's say there's been some kind of horrible explosion, and a hospital has, 8 or 9 people that are brought in, and each one of them has burns, all right? Well, triage means you've got to decide who needs care right now or they're going to die, versus who is basically going to be okay and we can wait a while and deal with them. They're really not in any serious trouble. And then there's sort of an intermediate category of people who definitely need attention now, but they're not quite as serious as the most serious of all. So triage, 3 categories. So when the people come in with burns, for the rule of nines would be a good way to try to do the triage. So if someone comes in, let's say, and the back of their head is burned and one of their arms entirely. So how much would that be? Well, that would be 3 times 4.5. That'd be 9 plus 4.5. That'd be 13.5%. Let's say somebody else comes in, one of their legs is burned entirely plus half of their trunk. Well, that would be 27%. So you see, we can now estimate who has more burn damage and who is in more immediate need of care. Okay? That's the rule of nines. Burns often lead to dehydration and sepsis. Sepsis is a very serious condition where you end up with organ failure. You've got an infection in the blood, leads to organ failure, leads to septic shock. Sepsis can be fatal. So burns are an extremely serious injury, never to be taken lightly. We can classify them by severity. First-degree burns damage only the epidermis. And you've had a first-degree burn at some point in your life, haven't you? Yeah, that's a sunburn. Gets red. It's, kind of uncomfortable. Normally will heal on its own in a little bit of time. Second-degree burn is damaging the epidermis and the upper dermis. So that papillary region of the dermis is now involved. This is where you get blisters, and you can do that from sunburn. I've gotten bad sunburns where I form blisters. This is where you damage not only the epidermis, but that papillary region as well. So this is starting to get a little more serious. Normally this will heal up on its own. You just got to be careful. A little aloe vera, something, First and second degree burns, each one of those, they're known as partial thickness burns because you've only gone part way through the skin. In contrast, third-degree burns damage the entire dermis. This is not going to heal on its own. They're called full-thickness burns. You have to debride them, or debride, people say it both ways. And they often are going to require skin grafts, all right? So you see in that illustration on the left, third-degree burn all the way through the dermis. You need serious medical attention right now. Transdermal drug administration, great word here, transdermal. Trans means across, derm, skin, so you administer drugs across the skin or through the skin. They go from the outside to the inside. A method of drug passage across the epidermis into the blood vessels of the dermis. Remember, there are no blood vessels in the epidermis, it's avascular. We got to get the drug into the blood vessels of the dermis. Drug absorption most rapid in areas where the skin is thin. So oftentimes you might see it on the sternum, on the iliac crest, over on the hip area, sometimes behind the ear on the mastoid process, remember? Examples are nitroglycerin. People with heart conditions, they can get atherosclerosis, arteriosclerosis, narrowing of the arteries to the heart itself, of the coronary arteries, and you get chest pain from that. So nitroglycerin is a vasodilator. It will open up those blood vessels. So people will wear nitroglycerin patches. Normally, if you have a heart condition, you're just sitting down, you might be okay. But if you go up a flight of stairs, your heart suddenly has to work harder, and you might start feeling that pain and pressure in your chest. Well, the nitroglycerin transdermal can get right in there to the area and alleviate that pain. Scopolamine for motion sickness. So that's when they typically in the mastoid process behind the ear. So you see in the lower right illustration, prevent motion sickness with transderm scope. Like people going on cruises, you know, if they get a little seasickness, you just put on those scopolamine patches and maybe that'll help with the seasickness. Scopolamine in higher doses, by the way, is one of what's called the belladonna alkaloids, and they produce a dissociative, almost hallucinogenic kind of state. Those people in the illustration on the right, I think they might have put on a few too many scopolamine patches. Normally you shouldn't be quite that happy just from wearing transderm scope. Estradiol. So estradiol is the main estrogen. Estrogen is actually a category of hormones. Estradiol is the main estrogen. Sometimes women going through menopause, you lose estrogen as you go through menopause. Estrogen secretions decrease. So there's what's called hormone replacement therapy, HRT. Sometimes women will wear estrogen patches. One of the problems here is estrogen promotes bone growth, and so women, as they go through menopause, end up with weaker bones, end up with osteoporosis. So the purpose of the estradiol patches was the hormone replacement therapy was to try to prevent osteoporosis. It had an unfortunate side effect in that it seems to promote breast cancer in some cases. It's a complicated situation. I don't know all the details of it, but at any rate, oftentimes now they are more likely to use. So, for example, my wife had breast cancer, and it was one of the estrogen-based breast cancers. So she does not take estrogen. That would be a very bad idea in her case. She instead takes, what do you suppose? What might you take in order to make your bones strong? Yeah, calcium supplements and vitamin D. That's what she does. Nicotine, people who want to stop smoking, you put on the nicotine patches. What happens is if you're addicted to nicotine, when you smoke a cigarette, it raises the nicotine levels in your bloodstream. Then in between cigarettes, the nicotine level starts to drop and drops further, and then it drops more and it drops more. And when it starts dropping really low, that's when you feel the craving for a cigarette. So the idea of the nicotine patch is to create a constant level of nicotine in the blood so those cravings go away. Seems like such a great idea, doesn't it? You know, I've seen smokers trying to quit who are wearing nicotine patches and smoking at the same time. And by the way, there are long-term studies on this right now. You know, they got the gum, whatever it's called. You can chew gum with nicotine. They got the nicotine patches. A lot of long-term studies are now showing that these things basically, people who use these don't have any better chance of stopping smoking than people who just go cold turkey. There's basically only one thing that will get you to stop smoking, and that is the firm desire to stop doing it. And you just have to do it. So skin disorders, wound healing. It's interesting the way that skin heals, and I would like you to know just basic 4 steps here. It's not complicated at all. So blood vessels bleed into the wound, all right? So what's going to happen here? That's like bringing the troops and the supplies to the area. Blood is actually got a lot of nutrients in it. So when you bleed into the wound, you're now bringing lots of nutrients in. The blood is going to clot and form a scab. That's basically like securing the perimeter. You don't want bacteria getting in there. You want everything to stay nice and stable while you heal the area. Macrophages and neutrophils and other leukocytes, all types of white blood cells, those migrate. They come through the blood, by the way, and they kill all the bad guys. So that's killing the bad guys and removing the dead bodies. The macrophages eat up the dead bacteria and stuff, so that's where you would be removing the dead bodies. So that's the next step, okay? Then germinative cells, all right, stem type cells, will migrate to the area. Blood vessels will regrow. Granulation tissue forms and you rebuild the area, all right? We're now actually repairing the tissue. And finally, fibroblasts come in and create some scar tissue. That's basically to fortify the area. So, you had a wound there once. Let's try to make sure that doesn't happen again. So your body puts an extra tough layer on top of that. That's basically what a scar is, to make sure that it doesn't happen again. See, it all makes sense. Steps are not hard. I would expect you to know those 4 basic steps, okay? Yeah, got the Rona again today. Skin disorders, skin cancer. Skin cancer is a big deal. They keep, I don't know what, if it's the number 1, number 2, number 3. There's so many ways to count that stuff, and it keeps changing. I don't even try to keep track anymore. But it's a very common kind of skin cancer, a very common type of cancer, and it's potentially very serious. So let's take a look. Skin cancer caused by excessive exposure to sunlight or UV light from any source. So where else might you get UV light other than the sun? Yeah, like maybe from a tanning bed. Risk factors for skin cancer: skin type, people with pale skin. Those people, live up by the poles, the gingers and stuff, the cheeseheads, pasty white skin, more likely for them. Amount of time you spend outside. People who work outside for a living, they're more likely to get skin cancer. Family history runs in families. Age, older you get. Immunological status. If you have something like rheumatoid arthritis, an autoimmune disorder, and you have to take immunologic drugs to suppress that, unfortunately that increases your chance of other kinds of disorders. 3 most common kinds of skin cancer. Basal cell carcinoma. This is the most common by far, but it rarely metastasizes. So metastasize might be a word you've seen before. Metastatic disease is what it's called. That means that the cancer moves from one place to another. A lot of cancers, if they would stay put, they're not a big deal. Cancer becomes problematic when it metastasizes. So cancer that starts in the skin can metastasize, and the next thing you know, you got bone cancer, brain cancer, liver cancer, and so on. So the whole trick with cancer is to stop it before it metastasizes. Then the prognosis is actually very good. Basal cell carcinomas are kind of the luckiest cancer to get, because a lot of times people have them for months or even years and they don't metastasize, they stay put. Squamous cell, a little iffier. Well, let's back up for a second. Basal cell, why do they call it basal cell carcinoma? What part of the skin do you suppose it involves? Yeah, it's the stratum basale. It's that basal layer, all right? And that makes sense because, again, the UV light affecting the DNA of the stem cells and the melanocytes and the keratinocytes down there, that's going to cause DNA damage and potential cancer. Squamous cell, that happens further up in the epidermis. This is iffier. Sometimes it metastasizes, sometimes it doesn't. Malignant melanoma, this is the most dangerous. It's actually the least common. That's a misconception people have. They think, oh, it's the most common. No, it's not. It's actually the least common. But it metastasizes very rapidly. You really got to watch out for malignant melanoma. It can literally go from being okay to being like, all she wrote in a matter of months. Only 5% of the total cases are of all skin cancers and malignant melanoma, but it is one of the most common in young adults. That's why, especially those of you people that have got those, people often call them moles. Really, the name is a nevus. When you got those little spots, those weird-looking things, check them. All right. Check them periodically, and the biggest sign of trouble is if they're changing. That's when it's time to go see a doctor. If you got a spot that's changing, go see somebody. Have them take a look, okay? Why is it called malignant melanoma? Because it arises from melanocytes, all right? Key to treatment is early detection. You have what are called the A, B, C, Ds of cancer, and there's actually an E now, but I don't do it in this class. Well, let's just do A, B, C, Ds. A for asymmetry, meaning one side doesn't match the other. So like, humans are roughly symmetric. We have a left side and a right side that are roughly the same. Asymmetric means it's an irregular blob, all right? Border, a jagged or a blurry border is a sign of trouble. Crisp, sharp borders, usually okay. Jagged or blurred borders could be a sign of trouble. Color, so if it's a solid color, that's probably okay. If it's mixed colors, that's a sign of danger, okay? And again, diameter, if it's less than 6 millimeters, here's why you have to know the metric system, all right? So again, I know my index fingernail is 1 centimeter wide. That's 10 millimeters, so half of my index fingernail. Bigger than that is often a sign of trouble. Now, look, don't think you can totally diagnose this on your own. You can't. These are just ways to spot potential trouble. If any of these things if you're registering a yes for any of these, then you need to go see somebody, all right? Don't rely on your friend who knows somebody who works in a doctor's office, okay? You need to go see an actual doctor. So here's a little test for you. You can see A and B. I'm telling you right now, one of those is just a normal nevus, and the other one is actually a malignant melanoma. Do you know which it is? Is it A or is it B? Think that over for a second, pause the video, come back, and I'll tell you. Okay, so A is just a regular nevus. Lots of people have things like that. B is trouble. Look at how it's big. It has a blurry, jagged border. It's got lots of different colors in it, and it's not symmetric. It's not even on both sides. Whoops, I talked over the transition. I guess I'll start again. This is something I think that is worth talking about. According to the CDC, indoor tanning salons cause an estimated 450,000 cases of skin cancer every year. In contrast, smoking causes roughly half of that every year. Lung cancer. So skin cancer is an incredibly common cancer. Again, I don't know exactly where it ranks. I don't care. But it's very, very common, and it's caused in large part by these tanning salons. Oh my gosh. People who begin tanning before the age of 35 have a 60% higher risk for malignant melanoma, a direct link. Indoor tanning units can produce 15 to 20 times more radiation than the midday sun. Indoor tanning increases the incidence of wrinkles, eye damage, immune system suppression, and cancer in unusual areas like the labia, the penis, the scrotum, and the nipples. See, you know, when you go into the tanning booth, you wear that little thing over your eyes, but a lot of people are in there, you know, naked or in just like little bikinis or Speedos or whatever. Well, because the inside of the booth is reflective, the UV rays bounce in every direction. They bounce right up underneath those little pieces of cloth you're wearing. And yeah, that's why you get cancer of the areola, cancer of the nipples, cancer of the penis and labia. Oh, God. I don't think I'd want to have cancer in places like that. So 60% of college students report using indoor tanning. 70% of those using indoor tanning are white females between the ages of 16 and 30. You know who you are. This is really crazy. Indoor UV tanning beds are really nuts. You guys, you got the spray-on tans instead. You know, do that. So just don't. You know, they should call them skin cancer salons. They really should. So again, there you see basal cell carcinoma on the lower left, squamous cell carcinoma, malignant melanoma. And here for the ABCDs, you see symmetrical versus asymmetrical, even borders versus uneven borders, smaller than an inch, larger or a quarter of an inch, larger than a quarter of an inch. See, they should be using the metric system, the dumbasses. See, an inch is 2.54 centimeters. That's be roughly 25 millimeters, and a fourth of that be 6, and that's what we said earlier, 6 millimeters. And you see one color versus multiple colors. So, you know, check those little spots on your body. You've got ones, you know, places you can't see. Have somebody you trust check those, or go to the doctor. But pay attention to this. It's a big deal. Skin cancer is a big deal. All right? We are done with the skin. Next comes the bone.